my name is Lexi and I'm one of the nurses here at the office. I'm here today to go through some post-operative care instructions for our patients that have had either one tooth removed or several teeth removed. Now normally these instructions would be given to you live in person by a recovery nurse in our recovery room, but of course due to the COVID pandemic we've had to sort of revise some of our protocols. So I'm here today to review these instructions with you. Now each of our patients upon discharge will receive this care pamphlet, and I'd just like to take a few minutes to review that with you now. So let's start with post-operative bleeding. Following an extraction or multiple extractions, bleeding is to be expected, and of course varies from person to person and procedure to procedure. To control the bleeding, please use the gauze that we're going to provide for you. The gauze must be placed directly over the extraction site and biting pressure applied for 20 minutes at a time. Continue to change the gauze every 20 minutes until the bleeding has pretty much stopped. When you get down to like a light pink, a light brown color with a bit of saliva mixed in, you're done. As long as there's red stuff, keep doing it. Remember to remove the gauze before eating and drinking, and I know that sounds funny, but with freezing in your mouth, you'd be surprised. So make sure that comes out before eating and drinking. Try to minimize your talking and your physical activity. For troublesome bleeding, try a damp tea bag. Now you can take a Tetley tea bag or a red rose tea bag, dampen it a little bit, put it directly over the extraction site, and bite gently for about 20 minutes at a time, and this should help to sort of expedite slowing the bleeding down. Particularly for our patients who have had intravenous sedation or anesthesia, if you're going to nap when you go home, ensure that you nap on your side so that someone can keep an eye on your gauze, and please don't go to bed tonight with the gauze in your mouth. It's a choking hazard. All right, bruising and swelling. Along with bleeding, bruising and swelling is very individual and it varies from person to person. Fair-haired and fair-skinned people tend to bruise and swell a little bit more than others, and difficult procedures as well may cause more swelling and bruising. This will normally peak on the 3rd and the 4th day following your surgery, and then it will fade away. Now ice packs can help to minimize this swelling, and for those that have had multiple or more difficult extractions, we do recommend that you use an ice pack, 20 minutes on your cheek, 20 minutes off your cheek for about the first 24 hours. Don't worry about using the ice pack when you go to bed tonight, we just want you to sleep. But during your waking and resting hours, please use the ice pack as best you can to help minimize any swelling. So local anesthesia. For every procedure that we perform, local anesthesia or freezing is used. The freezing used in the lower jaw can last anywhere from 2 to maybe 10 hours or longer in some people. Please don't be alarmed if you are numb for a good portion of the day. The freezing that we use in the top jaw can last anywhere from 1 to 2 hours, maybe a little bit longer depending on you, but that will of course fade away. But please call if the feeling of being frozen persists past the first day. So things to do. The day after your surgery, begin to carefully brush your teeth, avoid the surgical sites of course, and start rinsing with warm salt water. Please continue to rinse your mouth with warm salt water 3 to 4 times a day for a full week, and this will help to prevent infection and keep things clean. Start eating soft foods whenever you are able, although this can be challenging with a numb mouth. Keep the food soft and not too hot, especially while you're still frozen. Slowly increase your diet to firmer foods as the swelling and the stiffness and the discomfort fade, and let comfort be your guide. But certainly for the first couple of days, you may be limited to soups, scrambled eggs, mashed potatoes, smoothies, and pretty much anything that goes into a blender. Try to keep everything cool and not too hot, especially when you're frozen. And another reminder for things to do, for our patients who have received intravenous sedation or anesthesia, when you first arrive home, you're going to be tired, you're probably going to want to have a nap and lie down. Please lie on your side or propped up in like a lazy boy chair to avoid choking on the gauze. So things to avoid following your surgery. Please avoid popcorn, nuts, small seeds, and hard crunchy foods in order to avoid the particles getting stuck in the extraction sites. Popcorn especially, try to avoid this for at least a month. Avoid using a straw with thick liquids. Things like apple juice and water, it's not really a problem, but for something like a smoothie or a milkshake, please avoid the straw, as the suction created can lead to bleeding and infections. Eliminate or reduce smoking as best as you possibly can. This can affect the wound healing and even cause an infection. Irrigation syringe. For our patients that have had extractions in the lower jaw, we will provide you with an irrigation syringe that you can use to flush out any food debris. Do not use this until the 4th post-operative day, and only use it once a day with warm water until the extraction sites have healed. So I'll use my little model for an example here. For someone that has had a wisdom tooth out at the very back of the mouth, you're going to fill the syringe with some nice warm water, drag it along the last tooth, just drop it gently at the edge of the hole, give it a very, very gentle flush. That will get any food or anything that gets stuck down there. Once again, use it once a day, maybe at night before you go to bed, and do it until the site is healed. So now I'd like to demonstrate gauze usage, and I will use it as an example, someone who has had their wisdom teeth removed. We're going to send you home with lots of this gauze, so don't worry about going to the drugstore to pick some up. They'll have plenty. For our wisdom teeth patients, what I do is I take the piece, we open it, roll it very gently, not too tight, roll the one end just past the halfway point. Now we'll just pretend this is the mouth. Wisdom teeth are at the very back of the mouth. You're going to take this piece, go right to the very back of the mouth, and bite down, gentle but firm pressure for about 20 minutes at a time. And the nice thing for our anesthesia patients and our sedation patients, this little tail is going to hang out of the mouth so you have a visual that the gauze is still in the mouth. So a question I get frequently is, when do I call the office or when do I call the oral surgeon on call? How do I know there's a problem? There could be several reasons for this. The first one is if your bleeding is excessive or it's causing you concern. As I said before, the bleeding should get less and less as the day goes on, but if it's persistent or it's concerning you, call. Number two, persistent nausea and vomiting, and luckily this is very, very rare, but it can of course affect your nutritional intake, your hydration, and your pain management. If you're experiencing this, please call us right away. Pain that is not managed well with pain medications at any time, whether it's immediately post-operative or even later on in the course of your recovery, if you're not managing your pain, please call. As well, pain that increases after your peaks day 3 and 4. So on the 3rd and the 4th day, pain, swelling, and discomfort will hit a peak, and this is very, very normal. If you find this improves and then gets worse again, there could be something going on. Please just give us a call and we can get you in to have a look. As well, call us if you have any questions or any concerns at any time. If there's something concerning you, we're here, give us a call. And just a final reminder for our patients that have received sedation or general anesthesia, you may feel terrific the day after your surgery, and that's great. But please don't overdo it, since day 3 and 4 are when swelling, stiffness, and discomfort are at their peak. Be sure to rest and get the healing off to a good start. If you're too active and do too much too soon, healing is delayed and recovery is prolonged.